Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I do is perform cosmetic or aesthetic surgery. A lot of my practice is breast surgery, cosmetic breast surgery, and I have a fair number of patients that come into me for a breast reduction. What is a breast reduction? A breast reduction is generally when someone has too much breast tissue and we want to remove that excess tissue. That excess breast tissue usually goes along with some droopiness, some enlargement of the nipple areolar complexes, and generally nipples that turn downward. So that whole complex makes people come in. The heavy weight that can happen with excess breast tissue can often cause shoulder pain and strap marks, and all of those things tend to cause discomfort and make people want to address that. The other thing is that generally with excess breast tissue, or macromastia as we call it, I think it really can affect someone's body image. I think people can feel very, very heavy. I know that a lot of women that get breasts at a young age feel that it gives it gives too much attention to their breasts, and they become very self-conscious about that. And basically, the thing that can be done about for all this, it would be a breast reduction. A breast reduction is actually an operation where we make incisions around the nipple, generally down the center of the breast and along the inframammary fold. And basically, we remove the excess skin, put the nipple back to its perky location at the center of the breast, and generally remove breast tissue laterally along the lateral portion of the breast, and we like to maintain cleavage. Now, the breast reduction is a great procedure. I think the scars fade beautifully, and most patients, feel that afterwards they kind of kick themselves, why didn't I do this sooner? Because they're much more comfortable, they feel better in and out of clothes, and overall I think it improves their quality of life. A common question is, how long will a breast reduction last, and will they need to have it redone? Basically, the breast reduction and the results depend upon how much breast tissue you have. People that have a nice amount of breast tissue, especially younger patients, are going to have a longer lasting breast reduction that maintains its shape longer. In older patients that have a lot of fat in the breast, those are the patients that are not going to maintain their shape as well. The skin tends to have less elasticity, and they'll tend to bottom out, as we call it, where they feel like they look hollow along the top, and those patients ultimately may want to have a breast implant put in. But in terms of how long it'll last, I think you should talk to your plastic surgeon, go over some photographs, and I think by being examined and getting an idea of what your tissue is like, how much breast tissue you have, and what your skin elasticity is like, I think that'll give you a better idea about giving you an informed decision about how long the breast reduction will last. Overall, though, I think it's a great operation. I think patients are very happy. Thank you.